When you're being seen as a patient in a pain clinic, you might kind of wonder why the pain specialist is asking you all sorts of slightly strange questions that don't seem to be directly related to your pain. And the reason we do that is because pain specialists are actually looking for whether there is the presence of associated conditions that might influence, positively or adversely, the management of that pain condition. And one of the common ones that we are looking for is post-traumatic stress disorder. Because post-traumatic stress disorder and chronic pain probably go hand in hand at least 10% of the time for patients who have persistent pain. So they are common bedfellows. And we know that the patient who has the combination of those two, if they're not properly addressed together, tends not to do as well as the patient who just has pain alone. So it's very important to actually understand and discover if the patient does have post-traumatic stress disorder and then focus on how we're going to go about treating that. So a few words about PTSD then. Post-traumatic stress disorder. So it means that something traumatic, or at least perceived to that individual to have been traumatic, has occurred, and then after that event has passed, and after the danger of that event has passed, there are ongoing symptoms that are distressing and provide a stress response that are occurring on a daily or weekly basis. So the kind of things that we talk about is, for example, somebody's involved in a motor vehicle crash, and they might be rear-ended by another car, for example. Now, I don't know if you've ever been involved in a motor vehicle crash, but when it occurs, the noise is quite deafening, metal on metal, and it really can be quite a scary situation as you're trying to work out, are you going to be injured or not? So your sympathetic nervous system, your flight or fight response, is put on most massive alert that it can be. And then obviously as you realise you're not injured, that flight and fight response can settle down and disappear again. But for some individuals it doesn't. It keeps in the arousal state, or a state of what we call hyper-arousal. And that can then lead to a number of features. It can lead to nightmares that occur at night time, where the kind of event is occurring in the dreams. There can be flashbacks, where you can almost relive the traumatic event or the circumstances before or after the traumatic event. And intrusive thoughts, where thoughts pop into your head frequently, and you can ruminate about certain things, for example. And you may need to actually avoid scenarios that are similar. So the person who's been in the motor vehicle crash and has PTSD symptoms afterwards might be uncomfortable to be a passenger in a car, for example, or may not be able to go past the point on the road where that occurred, for example. What has all this got to do with pain, you may ask? Well, one of the features we know is that the hyper-arousal isn't restricted just to sweaty palms and a fast pulse rate and a sense of agitation or anxiety. It also feeds into elevating the output from the adrenal glands, the amount of adrenaline and noradrenaline that occurs, and that feeds into pain networks. So it helps keep the networks of the pain signal going round and round in the body, if you like, to use a common term. And we will struggle to get somewhere unless we treat the PTSD and the pain at the same time. So your doctor might ask you to see a psychologist to help work through and talk through the events of the PTSD, which is one of the treatments that has been shown classically to be highly effective for managing PTSD symptoms, talking therapy. The doctor might suggest that you see a psychiatrist to actually look at medication around that. There's specific medication that's used to block the nightmares, for example, taken before bed. And at other times there's medication that's used. Sometimes it's antidepressant medication or anti-anxiety medication that's used to manage the symptoms of PTSD. Or the pain specialists themselves may engage in that process. And we find that once we start treating both together, the patient has a much better quality of life, is less troubled by these intrusive thoughts and the nightmares and so forth, and the pain is much easier to control. So make sure that if that is really a part of what you're experiencing as a person, that you bring those symptoms to your doctor and have an open discussion around them, because they can certainly be treated.